Good morning, everybody. Welcome to the next version of Conversation. Today, I am with Senator Stephanie Hansen, who represents Delaware State's District 10. I'm also a constituent of hers, and I'm absolutely delighted that you're able to talk to us, Senator. Thank you for joining me.
Oh, thank you for asking.
I speak to you under, very difficult circumstances. Perhaps the state of Delaware has reached its peak. But before we start talking about coronavirus, I also want to let our audience know that not only are you a senator, but you are also an environmental lawyer, and you have practiced environmental law before you joined the Senate. So keeping that in the background, I want to ask you as to, are we now at that moment in Delaware where we are at sort of the peak of the coronavirus infection in our state? We had 7 deaths yesterday.
No, we are not there. It looks like I think earlier models were suggesting that we might have actually been at our peak a couple of weeks ago. We see that that was not true, unfortunately, at all. And where we seem to be slowing down in the rate of infection and hospitalizations in Newcastle County, at least slowing down from the number of them increasing every day, that number has greatly increased in Sussex County. So to the extent that Newcastle County was beginning to slow down a bit, Sussex County has gone way up. That's because of the food processing industry down in Sussex County, the poultry processing industry. There have been a number of COVID-19 cases in those industries, and it's been a very steep spike. So at this point, no, we have not peaked. It's hard to say when we will. The hope is that within the next week or two, we will. And, in the meantime, we just have to do the best that we can in getting as much testing out there as possible and making sure that we continue to have the hospital capacity that we need. And we do. So that's something that people should take comfort in, is that we did not see the tremendous number of hospitalizations and infection rate that had been anticipated early on. And that's what you saw. If you take a look at nearly any hospital now in our state, you'll see that there are the tents outside, and there was anticipating many more cases and critically ill patients than we actually have. So that didn't come to pass, which is great. And as a result, we have hospital beds and capacity available to handle the current increase that we have. And we're just hoping that it slows down by implementing the social distancing and the things that we're doing right now. I mean, what we're doing now seems to be the right direction. It's just that things have not slowed down as a state.
You know, I checked the data last night, and we seem to have about 3,200 cases in the whole state and 89 deaths until last night. And what is interesting is that comparable to, say, Minnesota, a much, much bigger state, which has fewer infections, but nearly double the number of deaths. So we seem to be having a much better success rate in terms of recovery. But I also wanted to know that, as we look forward, it's not just the sickness and illness that is part of the coronavirus pandemic. It also has multiple implications, such as the economic fallout that is going to come out of the corona pandemic, and also the mental health issues which are going to be coming out of this issue. So how is the state prepared to deal with the economic and the other consequences of the coronavirus pandemic?
Well, right now they have set up certain meeting and groups and communication systems to try to get on top of that and stay ahead of that. So the governor right now has a group. He has assigned the Damian DeStefano, who is with our Small Business Administration in the state, along with the chair of the Delaware Prosperity Partnership, Kurt Foreman, and our lieutenant governor, to actively go out, proactively go out into our business community and solicit information on how we can address these steps going forward, what we need to look at first and how we can address it. And along with that, we formed, you probably heard, the multi-state pact with six other surrounding states, so that we are coordinated when we begin to open up. When we begin, because what you don't want is, you don't want a disjointed effort where perhaps we open up our beaches because we've reached that point where we can start opening things up again, but the beaches aren't open in New Jersey and other places, so everyone comes to Delaware. It's not coordinated. So this needs to be a coordinated effort with the other states on what's going to open up when, in a coordinated way, so that we continue to keep people safe. As far as mental health is concerned, we are seeing some of the effects of that right now. And I think the place that I've seen the effect is with our recovery community. We have many people, before the coronavirus hit, the other large public health threat that we were dealing with was the opioid crisis.
Yes.
And we really felt that we had a good handle on that, and we were beginning to really turn the tide on those things. Then the virus hit, and what we've seen now is that the increase in those deaths, those overdose deaths, have increased by about a third. So it's not just a minor uptick and a minor increase as a result of the virus, or a third. And the reason is because we are asking people to isolate. Isolation encourages depression and people that have a substance abuse issue to then self-medicate. And so that is and they're afraid to go to the hospital now. They're afraid to go to the doctor. There's that concern. We need to isolate, and they're not connecting on a one-on-one basis with their support groups that they had before, and this kind of thing. So that is one large mental health component that is really being affected right now. And I know that this is something that we've just come to see how bad the problem is. And DHSS is putting, has now, it was called a warm helpline, where you can call in and you can just talk to someone. It's not like you're calling them to report an overdose or something. Like you're calling just to kind of talk with somebody and talk through the issues that you may be having. But there's a lot that we need to do with the third increase. I mean, we went from 60 some deaths this time last year to 90 or so this year. So that's an incredible increase in this very vulnerable community.
I did speak with a psychiatrist in my previous conversation, and one of the things that I had asked her was that America was already suffering from a pre-existing condition, which is the opioid addiction and also the mental health crisis all over the country.
Yes.
Depression, suicide rates are up. I went and looked at the SARS epidemic in 2003 and 4, and from that it was obvious that the suicide rates had gone up by 33% or 30% after the SARS epidemic. And now with this further complications of job loss, loss of, if you lose your job, you lose your health care, and then you don't even have access to health care and counselors, etc. So it is quite possible that one of the biggest consequences might be the mental health crisis, which will sort of double team with the economic crisis. And I think policymakers seem to be more focused on the economic side of it. And I think, so I worry that maybe the mental health side of this crisis will be a bit overlooked. Do you think that there is enough constituency in Delaware which will make sure that the government doesn't forget this, besides the uptake in deaths?
I do. And the reason that I do is because we have something that I don't know any other state has, or at least few have, and that is that we have the Behavioral Health Consortium. So this was a consortium that specifically addresses mental health issues. A subset of that being the addiction issue that we're dealing with, but also it's the full spectrum of mental health issues. And that is a very, very active consortium that was put together just, I think, maybe 2 or 3 years ago, and has been working with the Pew Charitable Trust. And we have it's a very active group with many subcommittees that continues to meet um, uh, virtually throughout this whole pandemic. I've been on a meeting with a behavioral health consortium just, I think it was yesterday. The days kind of like
Yeah, merging into
they
the
merge together. It's like every day is a Tuesday, and I'm
yeah.
not quite sure. So we had a virtual meeting just yesterday, the Behavioral Health Consortium. And so, yes, I think that Delaware will not forget about mental health issues because we have an active behavioral health consortium that is actively discussing these right now.
Well, that's comforting. I also want to turn towards something else that you have been doing as part of the state is that you have tried and developed a multicultural coalition in the state of Delaware. And I was wondering if you could tell us a little bit more about it, because it is quite an unusual thing. I have not seen in many other places an explicitly multicultural coalition. Could you tell us about the initiative, how it
Oh,
works,
sure. Sure.
and why you thought it was necessary after getting elected?
Well, I ran in 2017, and then I ran for reelection in 2018.
Yeah.
And right after my election in 2017, well, during that process of running for office, I did a lot of door knocking in the 10th district. The 10th district starts down in Middletown, goes up through Bear Glasgow, and up to the just south of Newark, kind of at the Bob Carpenter Center and below. And I found when I was door knocking that we have many diverse communities represented in the 10th district. And unless you actually go door to door and start knocking on those doors and you get through thousands of them, you might not even know that. You could easily live in the Bear Glasgow area and have no idea that we have a significant Hispanic community or Indian community or African Caribbean communities, sometimes even within your same neighborhood. It depends on how well the neighborhood's coordinated. And it really seemed to me when I was talking to people at the doors that it seemed to me that there ought to be a forum where we could get together and get to know each other, because our communities tend to be insular. You want to be with people that are familiar to you many times, and so that fosters kind of an insularness about our separate communities. But now is not the time, that we should be insular. Now is the time when we need to be looking at and recognize that we live in a diverse community, and that when you get to know people from other cultures and get to understand them and see where they're coming from, we have so many commonalities and so many issues that maybe one is facing that we could be able to resolve in a more stronger and coordinated fashion if we were together in that. So I formed the Multicultural Coalition just by reaching out to various members in those communities that I'd met and begun to work with once I got into office. And we thought I said, well, how about if we get together on a regular basis? Let's get to know each other, because I mean, there's a lot of folks here. I bet you didn't even know we have a large Sikh community. Come and meet the Sikh community, and meet the African Caribbean Coalition as well, and that we have many from those groups too. So we started the meetings, and we found that there were certain things that everybody kind of wanted, that many groups wanted to talk about. For instance, so one of our earlier meetings was with law enforcement, because there had been some issue with hate crimes around the Middletown area in particular. So we had law enforcement come in and talk with us about that, and the result, what it looks like if you're someone that's experiencing a hate crime, and what you should do about it. And here are the people that you would report to, so we get them comfortable with law enforcement. We had an immigration attorney come in, because we have a large Hispanic community, well, many Hispanic communities, and their questions were many times centered around immigration. So we had an immigration attorney come in and talk about what is the current state of things, and what can you do to help yourself going forward. We had a number of the communities wanted to know, how do we get on the list of state vendors for procurement issues? Because financial independence is really powerful. And that's what you really need, is you need, as not just a community, but personally, the ability to participate in commerce and be able to be able to bid on things on state jobs as a minority or woman-owned business. How do you get to be on that vendors list? So we had someone from the state procurement office come in for 2 meetings and go through step by step in the application. And we probably had, I don't know, 35, 40 people that were there as part of our meetings, that were there with their application, filling it out, that could specifically raise their hand and say, okay, well, I have a question. On the, section number 6, it asks for this, and here's my situation. And you could get great one-on-one help. So, I mean, that, and then another big issue that we've just recently, not an issue, it was an event. We had the Multicultural Festival. So I thought, well, we've been having these meetings. We meet every other month or so. Why don't we do something more public than this? Let's do a festival. Let's do a multicultural festival, and in which we'll have vendors and food and demonstrations and dancing and music and all of that. And we can do this in a big way so that people in the surrounding community will go, wow, I didn't know that we had that, how many communities that we have here, and let's go take a look and see the Indonesian dancing or the Celtic dancing, or, there's all sorts of things that we have. And so we put that together. We held it down in Middletown. It was just this past September. Was very well attended. We had about more than 35 or so vendors, performers, musicians, this sort of thing. And we were, and about 350 people or so actually came through. So it was great. We were going to be doing it again this year, but obviously things are on hold right now. So perhaps it will come back. And it will come back at a later time. We were hoping this was going to be a continual yearly event, but it was wonderful. There were so many people that came that said they had no idea that our community was this diverse, and this was wonderful. The food was great, the music was good. We did turban wrapping. We had the Sikh Gurdwara come down and do turban wrapping. There was all kinds of really neat things that we had. So it was a great success.
One of the problems that is not spoken much about in this context is that the coronavirus is hurting minorities more than it is hurting, say, affluent communities, etc. For example, the statistics out of Louisiana and Illinois is astonishing. For example, at least last week when I checked, 70% of all who died in Louisiana were African Americans, and 40% of those who are dying after infection in Illinois, where the population is less than 20%, are also African Americans. There is also this fear that that perhaps undocumented communities are afraid to report if they feel that they have symptoms because of this entire, for the last 2 years, there has been this kind of a verbal war against immigrants and foreigners and people of different colors in this country. So is that also potentially liable to compound the problem of infection and underreporting of infection and then under testing? Do you think that at least in the state of Delaware we may have that problem?
I think that we do, yes, and a lot of folks in the in these kind of minority communities don't have a clear, don't have a common, like they don't have a family physician that they've been to see all the time. They don't have a pathway that they know exactly who to call all the time when they've got an issue. Perhaps they just show up at one of the medical walk-in units, or they show up at the emergency room when things get that bad. So, and that's, I think, why we've seen the huge increase that we've seen in Sussex County, is because here we have a perfect example of a minority community that was worried about we don't want to stand up, we don't want to make a fuss, we don't want a target on us in any way, And perhaps they didn't have a healthcare set up for them that it was easy to access and consistently access, so that they end up waiting until they're much worse off physically before they show up in an emergency room or a walk-in unit or to get tested. Now, what the state and that is what's happened, and that's why we're seeing this huge spike in Sussex County right now, because a lot of them are employed in the poultry industry. In response to that, what Delaware is doing and the governor's office is doing is taking a specific look at getting testing down into this Georgetown area in particular, and into these processing plants, and doing testing with them and giving them test kits with hand soap and mask and these sorts of things. I don't know about mask, I shouldn't have said that, but like a care kit for them to have. Trying to build relationships with them, but also give them access to testing and get them into the hospitals when they need to be in the hospitals for care.
You know, from a slightly global perspective, we are seeing these trends of hyper-nationalism across the world, especially in Europe and also in the United States. There is this rise of white nationalism and this fear. I mean, the world has become more diverse and is becoming more and more diverse every day. And we can see that in the United States, perhaps one of the most multicultural of countries. Yet there seems to be a backlash against it. So are states in some way self-consciously attempting to balance the xenophobia that might be coming from federal institutions and federal voices by being more, shall we say, open and more considerate of multicultural communities?
I think that is the case in Delaware, where we are trying to be more open and accommodating and acknowledging of multicultural communities. But you know, Delaware is not homogeneous when it comes to its politics. You know, we have Newcastle County, which is very Democratic. We have Kent and Sussex counties, which are more Republican leaning. And so you see that it's really hard this is like saying, is the state, have we peaked yet? Well, Newcastle County, you know, is somewhere, but Kent County, Sussex County particularly is on a different path. It's so important from a global perspective that we have a leader at the federal level that promotes multiculturalism and that says that right-wing extremism is wrong and it's bad, and there are not nice people on both sides. Yeah. You know, that's the message. That message needs to come through, because we don't have that right now. And I think until we have that at the federal level, we're fighting a battle at the state level. And we're fighting a battle even within our own state, because there are different perspectives from upstate versus downstate. It's a very tricky, difficult issue.
You know, I'm also a senator at the University of Delaware, and our biggest concern now seems to be the financial situation of the university. We are so worried about the loss of revenue. We are trying to debate what will happen in the fall. Will students come back? If their parents lose jobs, will they be able to afford college? Even those who have applied for college and have been admitted to college, will they be able to attend? There's tremendous uncertainty. And it is obviously in these moments of uncertainty that state institutions will look towards the state for support. I'm not looking for an official answer, but is the state of Delaware economically healthy enough to help out large institutions like perhaps University of Delaware if we run into some kind of a financial crisis as a result of the coronavirus? Because if this continues into August, then perhaps we may not have the fall semester and we might have to push everything to December. I don't know what decision the management will make, but either we go online out of necessity, or we may, some universities are talking about moving it all the way down to December and starting the fall semester in December or January.
Mm.
So I wonder how healthy economically the state of Delaware is at the moment.
Um, I think that we are healthy. We are certainly on top of the issue, but it is a rapidly evolving issue. And the news is not good from one day to the next.
Sure.
So, we have the right people talking. We have our Office of Management and Budget is working very carefully with the Joint Finance Committee, who's also working very closely with our different state agencies and saying, where are we now financially? Because we had a good surplus
Yeah.
going into this year. We had $160 million surplus. Probably safe to say that that's gone.
Yeah.
Now we're looking at other agencies within the state and saying, are we going to have to look at cuts to those agencies? Are we going to have to look at, for instance, the Department of Transportation? Now you had a number of projects, large infrastructure projects that were on the books to be done, but maybe we're not going to be able to do a lot of those projects now. So I know that the state is working with the federal government right now on the next stimulus bill, which should be addressed to state and local governments to help with some of the issues, like the issues that you're bringing up as well. And we have a good relationship with our federal delegation, and our federal delegation is very well thought of in Washington. So you're not alone. We have the best structure that we could have right now as far as staying on top of it, being on top of it, hoping to work together to see where we need to go. It's just that every day things change, and
Yes.
it's so wild. It's hard to predict. And so the best thing that you can do, since you can't really predict, we predicted our peak, 2 weeks ago? That didn't happen.
Yeah.
It's really hard to predict these. The best that you can do is put together your structure, the right people talking, so that when things change, because they're going to change, you automatically know who you need to talk to. You automatically know these are going to be the issues that you need to talk with this agency about. And here's where we need to go to talk about this pot of money or this group of people that are going to be affected. So I think we've done a good job at identifying all of those, and we have a good job going of who's talking. So that's where we are. That's where we are right now.
This is my last question. As far as the federal government is concerned, they can print money and they can keep on printing money till it becomes very dangerous. But for states, that is not an option, right? And especially, I think the Delaware state is constitutionally constrained about how much of deficit financing we can do. So what happens to us? Do we go and borrow this money from the feds if we need more money in the near future, or what do we do as a state?
Well, I think that's something that's obviously being discussed right now. That's an Office of Management and Budget, JFC question. We have a constitutional requirement to have a balanced budget.
Yes.
So we're going to have to get that money from someplace. And, perhaps it does come from the federal government. I don't know. I just don't know.
Well, thank you very much for talking to me, Senator Hansen. I must congratulate you. You are a very strong voice for multicultural communities in Delaware, which is a very diverse state. And I have attended several, at least 3 of your coalition meetings. And I was very delighted that such an initiative was being taken, especially in this part of the Delaware where there are so many diverse communities. I also wish you all the best to you and to your family to stay safe under the circumstances. And I can't think of anybody better than you to represent my district. So thank you very much.
Thank you. Thank you for inviting me, and stay well. And I hope your students stay well as well.
Thank you very much.
Thank you.